What we've done is we've now created a network of about 500 employed primary care physicians distributed all through the 9-county region. Our thoughts are that under healthcare reform, primary care is really going to be the major component within the healthcare delivery system that will get the most attention, which is not necessarily the case today. So we now have about 500 employed physicians in an organization called University Hospitals Medical Practices that spans this 9-county region. First in from that are now our ambulatory centers, and if you think about where they're located in your mind's eye, obviously you know the geography here, but it extends everywhere from Ashtabula County, so it's in Conneaut, Geneva, now Concord, Twinsburg, Sharon, Medina. We opened up Chagrin Highlands back, I think, about 11 or 12 years ago, as well as a new place on the west side that we opened up about 8 or 9 years ago, Clay Grove. And so that's our first in-group. And then if you look, the next level in from that would be our primary and secondary care hospitals, and then of course our tertiary coordinator care campus. So we feel that we're uniquely prepared now for healthcare reform because we have a broad distributed network of primary care physicians. We have multiple levels of care, primary, secondary, tertiary, and coordinary, spread through a broad geographic region. That's all tied together with an integrated electronic medical record. As I said, less than 5% of the health systems in the country have a true integrated electronic health record. So we now have it in place for all of our inpatient facilities, soon for all of our outpatient facilities and physicians' offices. And as well, we work with about 2,000 private practicing physicians who send patients to us in the various regions that we serve. So we also have 2 partner hospitals. We have Southwest General, which is a partnership hospital, and we just recently created a relationship with Southwest as of the end of last calendar year. And about a year and a half ago, we created a new relationship with the Sisters of Charity of St. Augustine, where we are now 50-50 owners in St. John Medical Center. We've each agreed to put in $50 million over the next 5 years, or $100 million in order to focus on programs and services in that broad geography. So if you think about it, and if you were to just take a look from an overall demographic perspective, you know, if you were to draw some heat maps, you would find that within our entire region,